Welcome. Welcome to the course Public Policy Implications for Advanced Practice. I am Jane McCarthy, your instructor for this course. In this course, we will examine public policy in the United States and discuss some of the elements influencing the delivery of health care based on these public policies. We'll talk about policy formation at the national level and discuss current healthcare policy issues. Most of the time and effort that you will spend in this course will be learning what is actually contained in the Affordable Care Act legislation, more colloquially known as Obamacare. As you know, this legislation was passed by Congress and signed by the President in 2009, and as you know, it's being implemented right now. Now, a little bit about myself. I retired in 2007 from the U.S. Public Health Service Commission Corps. And in the Corps, I worked as a regulatory scientist. I started as a regulatory scientist for the Food and Drug Administration, where I was a reviewer there for anesthesia and respiratory devices in the FDA Center for Devices and Radiologic Health. I had several different positions over my 20 years at FDA, and finished up my work there where I was developing educational programs for the reviewers in the drug evaluation part of FDA. Also, during that time, I spent several years developing a congressionally mandated nurse anesthesia master's program at the Uniformed Services University, where I got my PhD. We put this program together to educate nurses to become nurse anesthetists from the Army, Navy, Air Force, and U.S. Public Health Service. I retired, as I said, in 2007, and now that I'm retired, I teach. I've always loved teaching, and I teach graduate students at Drexel University in Philadelphia, at the University of Maryland, graduate nursing students in Baltimore, and here at the University of North Florida. I work mostly from home, and I love the commute. I'm a strong proponent of healthy living, and I play tennis whenever possible and work out at the gym and swim. And so all that, now that I'm retired, healthy living is my goal. But my goal for this course for you is to make this an interactive class with you working with each other in both groups and individually using our Blackboard discussion board there on Blackboard. You will have readings from your textbooks. You have two excellent textbooks, I think, and you'll have readings from those textbooks each week. And you'll be given one exam on those readings. It'll be an open book exam, but I suggest that you keep up with those readings. I think it'll be more meaningful if you do that every week than just try to cram for that exam. In addition, I have some policy papers that I want you to read and respond to those on Blackboard. And then you'll also be doing a group paper and a presentation that you'll put up on Blackboard. And in this paper and presentation, you'll be working as a group to critically appraise a part of that Affordable Care Act. And then you'll share your presentations with everybody else in the class. So we actually all end up learning quite a bit about this new legislation. So if you want to reach me with questions, please email me. We can set up a conference call anytime during the course to discuss things. I'd be glad to do that with you. I live here in Olney, Maryland, and as I said, I have a part-time position there at UNF, and I've been there actually for 6 years. I do come to campus usually once each semester. So please introduce yourself using the discussion board as you'll see there on Blackboard. Tell us a bit about your clinical background and what you hope to learn in this health policy course. Again, welcome to the course, and I look forward to dialoguing with all of you and learning a bit about each of you. Okay, get started.